Hi, my name is Chanmi, and the pulmonary disease that I chose is the COPD. For my research, I chose the two articles that focus on the respiratory support for the patients with COPD. The first article examined high flow nasal cannula therapy during the COPD exacerbations. The second article examined whether the psychological support could improve the patient's acceptance and adherence to the non-invasive ventilation. So the first article was a systematic review of the 14 studies. It compared the high-flow nasal cannula with conventional oxygen therapy and the non-invasive ventilation, such as BiPAP. The review found that high-flow nasal cannula could lower the carbon dioxide levels, reduce the breathing effort, and improve the patient comfort. It may be appropriate for the patients with mild to moderate COPD exacerbations or those who cannot tolerate the non-invasive ventilation. However, the non-invasive ventilation was more effective for patients with moderate to severe hypercapnic respiratory failure. The article also found that long-term home use of high-flow nasal cannula may reduce the COPD exacerbations and improve the quality of life with patients with stable chronic hypercapnic COPD. The second article was a randomized controlled trial involving 90 adults with COPD who were beginning the non-invasive ventilation treatment. They divided into the two groups, the experimental group and the control group. The experimental group received the cognitive behavioral therapy, counseling and relaxation techniques, and mindful exercises. The control group received the standard care and educational videos. The results show that psychological support improved the non-invasive ventilation adherence and quality of life. It also helped the patients manage the problems such as anxiety, claustrophobia, mask discomfort, and the air leakage. So I chose these articles because they show two important parts of the COPD treatment. The first article focuses on the selecting the correct respiratory support, while the second one focuses on helping the patient tolerate and consistently use the treatment at home. So from a nursing perspective, this research is important for the care management of the patient. Nurses are often the healthcare professionals who spend most of the time to monitor the patient's breathing and response to the treatment. When caring for a COPD exacerbation patient, the nurse should also assess the respiratory rate, oxygen saturation, breathing sound, work of breathing treatment, and mental status and the ABG results when if it's available. If a patient is receiving the high flow nasal cannula, the nurse should monitor whether the patient's breathing effort and carbon dioxide level is improving. Even if the patient appears comfortable, worsening drowsiness like mental status, rapid breathing may indicate that high flow nasal cannula is not providing enough ventilation support. So the nurse should report these changes quickly because the patient may need the BiPAP or more advanced respiratory support. Nurses also have an important role in managing the non-invasive ventilation. So before assuming that the patient is refusing the treatment, nurse should ask why this patient is having problems. The mask may feel too tight, cause air leaks, irritate the skin, or make the patient feel anxious or claustrophobic. Nurses can work with the respiratory therapist to adjust the mask, protect the pressure areas, or provide humidification and improve the patient's comfort. This research is also informs the promotion of the patient's health. Patient education should be individualized and should explain why the respiratory therapy is needed. For example, the nurse can explain why the non-invasive ventilation does more than just providing the oxygen. It also helps moving air in and out of the lungs and remove the excess CO2. The nurse also can use the teach back method by asking the patient to explain the purpose of the non-invasive ventilation of therapy and demonstrate how this equipment should be used at home. Nurses can also teach relaxation techniques such as slow breathing, taking short breaks when and gradually becoming familiar with the mask while awake. Including the patient in the treatment decision may also help the patient feel more in control and willing to continue the therapy. Finally, these findings can help with the prevention of the further disease progression and complications. COPD cannot be usually reserved, but nurses can help prevent the exacerbations, respiratory failure, and emergent visits and hospital readmissions. This includes encouraging medication adherence, correct inhaler use, smoking cessation, vaccination, and physical activity as tolerated. Patients should be taught to report increased shortness of breath, changes in the sputum color or amount, fever, any mental status change, or decreased ability to complete the normal activities. So recognizing these changes may also allow treatment to begin before the condition becomes severe. For patients using the home high flow nasal cannula or non-invasive ventilation is also important. Nurses should assess the barriers during the follow-up visits and determine whether these patients understand the equipment and have enough family support and experiencing any side effects. Addressing these problems may improve the adherence and reduce the future COPD. Overall, these articles show how successful COPD management involves more than just choosing a breathing device. Nurses must monitor the patient's condition, recognizing the treatment failure, providing education, and assess their emotional state. Combining appropriate the intervention with the patient education may improve the quality of life and prevent the COPD complications. Thank you.